Are you in every way, woman?
We're back with Every Way Woman and the Doctors of Breastlink to talk about diet and fitness and how it relates to breast cancer prevention. And we touched about briefly before the break on fitness and active lifestyle. Let's talk a little bit more about that and what that means in prevention.
Yes, absolutely. There have been a couple large studies presented at our last annual meeting, and these studies have shown, one in the Netherlands and one here in the United States, show that there are health benefits, obviously, in the breast cancer patient population. And all of it seems to distill down to maintaining a healthy body weight. And to emphasize
but that's for patients and for preventative.
And for prevent, that's true. That's true. And so, and certainly in the study I mentioned, this looked at breast cancer patients that were followed afterwards, and certainly there's a benefit seen to premenopausal women maintaining an ideal body weight. But we also know that there are certain inflammatory cytokines and proteins that can predispose to cancer. And when we can lower those, we have a real strong belief that we can reduce a woman's risk of breast cancer also. But I will say, at this point in time, it's hard to make any specific diet recommendations with regard to lowering the breast cancer risk.
Is there any type of exercise recommendations? Because I know, the famous one where you squeeze,
Yeah, is it something like the more you exercise your chest or your breast, like the push-ups
My
or the
recommendation is
chest
get
flies?
on the pole. Get on the pole.
Or is it like cardio? Is it something like you're engaging your chest more helps?
It's cardiovascular health, essentially. Getting out, walking, whatever you can do to actually get your heart rate up is beneficial.
So it doesn't matter.
No special exercise. Yeah, you can.
What's this called? Like this? Like I'm squeezing my breast?
My grandma taught me that one.
Just wondering.
That's an old time remedy.
But briefly on the diet as well, I've heard a lot of rumors about red meat. I personally don't eat red meat, but is that something that, a lot of women, a lot of patients are choosing to be vegan?
Good question. There was one study that looked at young premenopausal women. Red meat intake had no correlation with breast cancer risk. So it's hard to really determine, what foods cause or don't cause breast cancer. But at this point in time, we can't make a statement like that. We can't really make any firm recommendations with regard to diet. I think, we all agree, especially as women get older, all the more reason to maintain a heart-healthy, stroke-healthy diet, maintain a healthy weight.
But when you say diet, I'm thinking of diet pills.
No, I don't mean. I mean like a
healthy eating lifestyle.
Healthy eating lifestyle.
Low fat.
Yeah.
Okay.
Yeah.
How about for the woman that likes to drink alcohol? Is that bad? Because I'm a drinker. Is that something that I should stop?
Seriously,
I do it classy,
if
but
you have more than a glass or two of wine,
just make sure you have vitamins.
Should I stop?
There is a correlation with heavy alcohol use and an increased risk of breast cancer. So, like I tell my patients, everything in moderation. And heavy drinking is not optimal.
What are vitamins that actually help? Like, D,
multivitamin.
Again, it gets into the nutrition question. We don't really know that one vitamin over another definitely helps. I think in terms of the alcohol question, there have been many studies looking at that. It looks to be about 3 alcohol beverages per week. If you go over that, you
3?
Yes.
That's like 1 every 3 days.
Nice.
Right. I'm having a glass of wine with dinner daily.
And that risk
really?
You need to cut it.
That risk mostly correlates with postmenopausal older women who are overweight also.
Okay.
Skip the alcohol. Coffee. I'm a coffee drinker too.
We like to caffeinate over here.
Okay.
Is that bad? Because I have a myth that it's bad, coffee. No.
It's bad for your teeth.
There's no data to show coffee clearly increases risk for breast cancer.
Okay, a person then who has gone through the treatment, you're not telling them to avoid anything?
Not necessarily. Everything, like I said, a nice high fiber, low fat diet, moderate alcohol exposure, exercise.
What about tomatoes?
Let's go on tomatoes.
Tomatoes. Everything you can find in the produce aisle are all the antioxidants you need to fight cancer.
So essentially these women who are choosing to heal their bodies more with a holistic approach and maybe turn vegan or eat strictly organic.
Yeah, because I have a friend that turned vegan and all she eats is French fries and like bread and carbs. She says she's not doing milk, fish. cheese.
So she's doing French fries. But what's interesting is that I do know several women who swear by feeding their food healthy living, or feeding their body healthy living foods, that
Right.
it helps.
And that's a good question. And we have studies that are ongoing looking at some of these, organic foods versus, prepackaged and processed foods. Our suspicion is that there are health benefits to all of this, and certainly in the other areas of health that are so important. There's one common misconception about sugar feeding cancer. And I think one thing that can be said is there's been no study to date that shows that cancer grows on sugar. The problem with sugar is it leads to patients being overweight and can cause other problems as well. A woman should have about 6 teaspoons of sugar per day. A man, 9 teaspoons. The average American has 22 or more teaspoons of sugar a day.
That's not good.
And that's a lot of it's in the
sugar buzz.
a lot of it's in the processed foods we eat. The pastas are enriched.
They're
with
not
simple
adding
sugars.
sugar. It's sugar that's already in the foods.
Yeah, with the common Western diet. So
We'll be back with more information and breast-link doctors when we come back. Stay tuned. That's fascinating. I have heard that sugar feeds.
Are you in every way woman?